Hello from the small window on your screen. This is Adam Turtletaub from the Healthcare Compliance Association. Joining us via Skype is John Falcetano, who's Chief Audit and Compliance Officer for Vidant Health. Most importantly for this call, John will be track chair for the advanced discussion groups, which will be taking place at the Compliance Institute in Orlando, Florida from April 19th through 22nd. John, thanks for joining us. Thanks for your help in putting the advanced discussion group sessions together. I think the first thing that would be good is if you could explain what the real difference is between advanced discussion groups and all the other sessions at the Institute.
Sure, I'd be glad to, Adam. When you go to the other sessions, you have a lecture, you have some questions and answers, but not as much interaction as you have at the advanced discussion groups. The purpose of the advanced discussion groups is to bring together compliance professionals that have been doing this for a number of years so that they can share their experience, their ideas, their processes and procedures that they put in places in different parts of the country. And it helps you when you participate in that because they may have a way of doing something that you haven't thought about.
And I think it's notable that the presenters aren't standing up there with PowerPoint slides talking through it. They're really there as moderators and facilitators of the discussion.
Exactly. In fact, the only slides that we allow are questions where the participants use a handheld device, and we'll ask a question where they get to choose on their handheld device, and then we talk about the results. Like we may ask how many of you are involved with the quality department, and how does that fit into your compliance program? And if you are, then press 1 for yes or 2 for no. And then we talk about the results, and then we'll go through, well, tell us how. So share what you're doing as it relates to quality and compliance at your organization that someone else may be able to utilize.
And I think it's notable that because they can answer anonymously, it allows for you to ask a lot tougher questions because people can share their answers without anyone knowing who actually was on which side of the question. So what are some of the topics that we'll be exploring this year?
Well, some of the topics this year is changing organizational culture when you don't have a strong culture of compliance and how you go about doing that in your organization. Identifying compliance risks as it relates to physician compensation arrangements. Working with the C-suite, sometimes when the C-suite isn't so sweet. You have to figure out how to do that. Compliance and due diligence. What is compliance role in the due diligence process when they're doing a new acquisition of a physician practice or a new hospital or expanding the services that they provide? And then with the new area, accountable care organizations, what is the compliance risks that are out there and how are they addressing it in their organization if they're involved in ACOs?
And you know, it's a lot of range there, everything from third-party risk to internal to, you know, outside parties you're partnering with. Who are some of the speakers that people will be hearing from?
Well, there's Jenny O'Brien from United Health, who's their Chief Compliance Officer. Ryan Mead, partner with Aegis Compliance and Ethics Center. Al Josephs, Lieutenant. Cheryl Baca, Chief Compliance Officer for University of California. Daryl Contreras, partner with JD Healthcare Partners. So we got a pretty good range. We have 10 advanced discussion groups. Most of them are repeated to allow more participants. We hold the class size down to 50, so that there's a lot of interaction and discussion.
And I think one of those things that raised a very good point is that we do limit the classes to 50 so that for those of you watching who might be interested in participating, what you need to do is sign up well in advance because there's no space for walk-ins at the last minute. We keep it at 50 so that you can have the better interactivity there. Well, John, thanks for taking your time not only doing this video but also in putting the agenda together for the advanced discussion groups. Look forward to all of you watching, joining us April 19th through 22nd in Orlando for the 2015 Compliance Institute. I'm Adam Turtletaub from HCCA saying thank you, John, for joining us. Thank you all for watching us, and look forward to seeing you soon.
Thank you, Adam. Take care.